All right, showing the room, full 360. Let me show my paper, making sure there's nothing on it. All right. Say hello to the camera, Parker.
Hey, Professor Potter.
Okay, I think it's still recording. All right, knock, knock. I'm closing the curtain or the door for privacy, doing hand hygiene. I'm making sure to rub this in until it's dry. Hello, my name is David Jensen. I'm going to be your nurse today. What's your first and last name?
Parker Shields.
Perfect, and what's your date of birth?
November 27th, 1998.
Okay, and could I see your wristband to verify? Perfect. Yep, that sounds about right. Do you have any allergies?
No allergies.
No allergies, perfect. So today we're going to be doing a head-to-toe assessment, checking all the functions of your body, making sure that everything's intact, similar to like a physical. Do you have any questions regarding that? Nope. Perfect. We will get started. To make things a little more accessible, I'm going to just drop this. I'm going to sit you up a little bit as well. Okay. And then I noticed that my client's mood and affect is appropriate for the current situation. Posture is fine, sitting upright. And then, are you, you already told me your name. Do you know roughly what time it is today?
It's roughly about 11:30.
Roughly 11:30. Yeah, it's pretty good. And then, do you know where you are?
I'm in Mesa, Arizona.
Perfect.
At Alverno College.
Yup. So my client is learn orient to person, place, and time. And then, do you have any pain right now?
No pain right now.
No pain. Perfect. And do you use any mobility devices or aids to move? Do you have any ostomies, trachs, tubes, IVs, anything that would hinder your mobility?
No.
No? Perfect. Okay. And then we're going to do a full set of vitals. Let me also write down that pain was a 0. Let me move this over here. Sometimes the SpO2 takes a while, so we'll put it on this hand over here. Just let that do its thing. Meanwhile, I'm going to get started with this 2-part blood pressure. There we go. Okay. 1 second. Make sure I put on some gloves. I believe you're clean, sir, don't worry, but just for personal protection, always a good idea. 100%, perfect oxygen.
Just the way I am.
All right, now for the 2-step, we put this here. It'll work with me. There we go. And I'm gonna feel for your brachial pulse. All right, went the wrong direction. There we go. Okay. Okay, so I lost it at 120. I'm gonna go all the way to 0, let his arm have a rest. Perfect, so we're gonna let that rest for a minute. Meanwhile, I'll assess your other vitals. Also, I'm gonna do a neurological assessment, so I'm gonna have you remember 3 words for me, okay? I'm gonna ask you towards the end of the exam. So the 3 words are shirt, flower, pencil.
Shirt, flower, pencil.
Okay, perfect. Now I'm gonna take your SpO2, which was 100, pulse rate, respiratory rate, blood pressure. Okay, so let me check your pulse rate and respiratory rate meanwhile. Let me use your radial pulse for that.
Go this back.
Sure. Unless you want to keep it. got your pulse rate at 64, respiratory rate was at 16. Let me document those real quick. And those are within normal ranges. Now we're going to finish up with your blood pressure. Go ahead and just relax and breathe, okay? And I'm going to be pumping it up to 150 for the 2 parts since previously it was at 120. (128/84). Alright, and that's within close to normal, could be considered elevated. Alright. Let me go and take this off, yeah. So we got your vitals and your pain assessment done. And your memory. Next step, we're going to be getting into your head assessment. Alright, with palpating your head, I'm just going to see if there's any tenderness. Just go ahead and let me know at any point, okay? So just palpating the head, feeling if there's any tenderness, lesions, abrasions, looking for infestations. Hair distribution is appropriate. Head is a normal cephalic shape. Did you feel any tenderness throughout that? Good. And I don't notice any bruising. And then looking at the face, I don't notice any tics, any involuntary movements. The color is even throughout. Same with the neck. Warm. Skin is dry. Color's consistent. And then go ahead and look up a little bit for me. Look back. Trachea is midline. And then I'm going to have you just sit forward a little bit. And then I'm going to check your thyroid. So I'm going to place my fingers around the neck, okay? Go ahead and swallow for me. Perfect. So no thyroid enlargement. All right. And then we're going to get into the ears. Or actually, I'm going to do eyes first. So with your eyes, I'm going to go ahead and I'm going to check with the light and just checking the size and checking out the area of your eyes, okay? So go ahead and look straight for me. Perfect. Awesome. And then can you follow my finger? Good. And then I'm going to have you look at this blue thing on the wall here, and then look at my finger. Look at my finger. Look at the wall. Now look at my finger again. Perfect. Okay. And then I'm going to have you go and pull down your eyelid, not your eyelids, but the bottom of your eye. Perfect. So your conjunctiva is pink, sclera is white. And then I'm going to measure your pupil size with my pen light. Pupil size is a 3 millimeters. And your eyes are round, reactive to light, and accommodation and convergence. And then I'm going to do the 6 cardinal signs to check your optic nerves. So go ahead and look at my finger. Go to the side. Out again. Up. Down. Up. Down. Perfect. No nystagmus noted. Cranial nerves were intact for oculomotor, trochlear, and abducens. 3, 4, and 6. And then, all right, we're going to get into the ears. Looking, observing, I can see that the ears are at good alignment. They're not uneven. I'm going to go ahead and palpate your ear. As I palpate, let me know if you feel any tenderness in the process, okay? You feel any tenderness on any of these areas?
Yep.
No? Perfect. So no tenderness, I'm checking and observing. There's no bruising trauma. Inside the ear, there's no drainage. I'm gonna check on the other side. So no drainage, bruising, or tenderness noted here either. Looking inside the ear as well. Okay. And then we're gonna go to the nose. Looking at your sinuses first. So on your maxillary sinuses here, frontal sinuses, and they're not swollen. I can see that the nose is midline. Go ahead and look up for me. I'm gonna look inside the nose. Nose has no drainage, lesions, bruising, or redness. And then go ahead and close one nostril at a time for me, and then breathe in. Perfect. Other side. Good. So nares are patent. And then we're gonna get into the mouth. Go ahead and smile for me. See no cavities or dentures, no braces. And then go ahead and open your mouth for me. I see that there's no white patching of the tongue. Oral mucosa in the tongue are pink. No lesions, sores, or abrasions. I'm also gonna check for the glossopharyngeal nerve. Go ahead and say ah for me. Ah. Perfect. And with phonation, I can see the uvula. Tonsils are not swollen. And then one thing that I just wanted to assess on the neck still was your lymph nodes really quick. So with the lymph nodes, I'm going to be feeling your preauricular, postauricular, tonsillar, maxillar, submental, and then your occipital. Did you feel any tenderness there?
Yeah.
There was no non-palpable and non-tender bilaterally. And then we're going to get into respiratory. So like this. Cool. So my client is on room air. No oxygen is being used. Inspiratory and expiratory look the same. Effort is the same. No accessory muscle use. I'm going to have you actually sit on the edge of the bed here with your feet dangling. Perfect. Now looking at the respiratory effort, I'm going to go ahead and now check to make sure that it's bilaterally even. Go ahead and breathe. Good. I'm going to check on the posterior side as well. Big breath. And release. Good. So bilaterally the same, posterior and anterior. And then I'm going to listen to your respiratory lung sounds really quick. We're going to be going in a zigzag pattern, listening to each lobe. Go ahead and just breathe normal for me. Nice deep breaths. And I just want to mention as well that we're doing this over the shirt. Typically it would be done on the skin, but for the sake of the video, it'll be over the shirt. And then we're going to go to the posterior and do the same zigzag pattern. Last big deep breath. Good. Okay, so we heard no adventitious lung sounds in the process. Lungs were clear bilaterally on both sides. All right, and then I'll have you go ahead and sit back down for me. We're going to be going over cardiovascular now. So with your fingers, can you put your hands out like this for me? I don't see any clubbing. Normal curvature. We're going to check capillary refills. And the color comes right back to pink. Perfect. That's within 3 seconds. Go ahead and lower your hands. I don't see any cyanosis. And then I'm going to check arms don't have any swelling, as well as the ankles. No swelling either. And then I'm going to check your peripheral pulses really quick, starting with the carotid or carotid. Start one at a time. That way I don't make you pass out. Good. It's a 2+. Let's see. I guess we can do it like this. Yeah, 2+ as well. And then brachial. You can check this side too. Two plus bilaterally. Wrist. Do the radial. 2+ bilaterally. I would typically do the femoral, but for the sake of this video, we will not be exposing my client. We're going to do popliteal on the back of the knee. Two plus bilaterally. Posterior tibial. And that is a 2+ bilaterally. And then dorsal pedis. And a 2+ bilaterally as well. So peripheral pulses are done. I'm going to listen to your cardiac landmarks. Actually, I'm going to observe really quick your JVD if there's any noted. Go ahead and just turn that way. Good. And then to that way. Good. No JVD noted. I also do want to listen to see if there's any bruits in your carotid arteries really quick. So go ahead and just turn that way for me. Hold your breath. Perfect. Go ahead and breathe. I'm going to go to the other side. I'm going to check again just to make sure. Go ahead and look that way for me. Go ahead and hold your breath. Now you breathe. Good. So no bruise noted on the carotid arteries. Now we're going to get to the cardiac landmarks. Honestly, it's probably best if I go on this side. And I'm going to state with my diaphragm the first time. Second time will be with the bell. We're listening at 5 cardiac landmarks, starting at the aortic. Then we're going to go to the pulmonic. Erb's point. And I can hear an S1 and S2 loved up. I'm going to go to tricuspid. And then the apical pulse, mitral, midclavicular. Perfect. So we do hear an S1 and S2 loved up. Now we're going to check with the bell of the stethoscope. Same spots, starting in the aortic. Pulmonic. Herbs. Tricuspid. And then the last, mitral valve. And I don't hear any S3 or S4 murmurs. All right. And after cardiac, we're going to go into the skin assessment. So with the skin, I'm gonna just check for skin turgor real quick. Pinching the clavicle. There's no tenting noted. Looking at the skin that's only exposed for the sake of this video. My client has no piercings, scars, lesions, ulcers, small little tat here. Color looks consistent throughout. Skin is warm and dry upon palpation. All right, and then we'll go into the abdominal section. How you doing?
Very well, thank you. Can't wait to go to jail after this.
Oh yeah. All right. So for the sake of this video, I won't be exposing his stomach, but I will be mentioning and verbalizing everything I would be looking for. So from two different point of views, two different angles, checking. So the stomach and abdominal section is flat, symmetrical. Hair distribution is even. There's no pulsations, lesions, abrasions, bumps or lumps. Can you bear down for me? Perfect. And I don't see any umbilical or inguinal hernias. And then I'm going to go ahead and auscultate each quadrant, starting in the right lower quadrant. There we go. So in the right lower quadrant, good. Moving up, upper right quadrant. Left upper quadrant. All right, and left lower. Good. I heard normal, active vowel sounds in all four quadrants. I will also check, last thing, the abdominal aorta with the bell of my stethoscope. Listening for any bruits. I don't hear any. All right, let's sit you up now. Let's see here. After abdominal, we are now going to get into your musculoskeletal portion. I'm going to have you sit up for me. Have your feet on the side of the bed. So, first thing, I just want to start on the posterior side, checking the curvature of your spine. So I'm just going to be palpating down the spine. And it is all symmetrical. I don't notice any abnormal curvature such as kyphosis or scoliosis. And then I'm going to go ahead and do a Romberg test. So I'm going to have you stand. Go ahead and put your arms out, eyes closed. I'm going to keep my arms right by your side. That way you don't fall. Perfect. Go ahead and sit down for me. That was a negative Romberg test, so you passed. No body was swaying. Good. And then I'm going to check your joints, and I'm going to palpate to make sure there's no tenderness or pain in any of those. Starting at the shoulders, then the elbows, wrists, good, hips, knees, then your ankles. Any pain in any of those areas? Good. Now we're going to check your mobility, so go ahead and just raise your arms up. Good. Halfway. Circles. Backwards. Lower. Now you can do bicep curls. Out. Good. And then with your wrists, go ahead and put them up, put them down, flip them, and rotate. And then inward, or whatever way. Perfect. Wrists are good. And then with your hips and your knees, can you go ahead and lift your leg straight? Good. Other leg. Perfect. And then now just bring the knee up on this side as well. Great. And then with your ankles, are you able to push down and out and then up? Perfect. And then are you able to rotate them? Now outward. Perfect. Go and relax. All joints have full mobility. There was no pain in any of your joints. Romberg test is done. I'm going to have you do a little walking test to check your gait really quick. So go ahead and come over here, right next to the wall. I'm going to have you walk all the way to this door. On the way back, you're going to do heel to toe, okay?
Show you that.
Pretty good. My patient has full mobility, steady gait, uses no mobility devices. Go and have a seat. Uses no mobility devices. There was no swaying. He was at full balance. All right. And then go ahead and get relaxed again. Now I'm going to ask you, do you remember those 3 words that I told you?
They're shirt, flower, and pencil.
Perfect. You got them right. Do you know your first and last name?
Parker Shields.
Great. Do you know you went to high school for?
I went to California High School in San Ramon, California.
Pass the test. So your recent, remote, and immediate memory are all intact. I'm going to do all 12 of your cranial nerves. So starting with the olfactory. I'm going to have you close your eyes and cover one of your nostrils with a finger. Perfect. Now tell me, what do you smell?
Smell coffee.
Perfect. All right, now cover the other nostril, keeping the eyes closed. What do you smell?
Lemon pepper.
All right, perfect. Olfactory pass. For the optic tests, I will have you actually stand up. Sorry, I'll have you come stand over here. You will have full mobility, so I trust you can walk over here. Stand right there is good. You're going to be looking at this chart over here for the Snellen test. Now, cover one of your eyes for me. Perfect. So with your left eye, can you read this top line?
Your 5 moments.
Perfect. Now cover the other eye. Now with the right eye, what can you see for this bottom orange line?
4 hand hygiene.
Perfect. And then with both hands down, with both eyes looking, what is the 3 letters you see?
N D H.
Perfect. Optic nerve is intact. Go ahead and have a seat again. And then for the ocular motor, you did already pass that with the 6 cardinal signs. With the trochlear, you also passed that with the 6 cardinal signs. For trigeminal, we are beginning to test your sensation on your cheekbones. So I'm going to be using, this is soft and this is sharp.
All right.
Go ahead and close your eyes for me and tell me which side you feel which.
That's soft on the right side.
Perfect.
That's hard on the left.
Perfect. Okay. That was intact. Trigeminal was intact. And then for the abducens, you already passed that, looking side to side during the 6 cardinal signs. For facial, let's go and take a look. Can you puff your cheeks? Can you smile? Perfect. Lift your eyebrows? Perfect. Symmetrical. Facial passes is an intact. And then for vestibular cochlear, for your hearing, I'm going to stand behind you and say a word and tell me what you hear.
All right. Monkey.
Yep, you passed.
Pineapple.
Perfect. Hearing is intact. And then glossopharyngeal, you did already have intact when we had you go with the tongue depressor, and I saw your uvular rise with phonation. And then for the vagus nerve, I went ahead, I had you swallow during the testing of your thyroid enlargement. Let's just do it one more time. So go ahead and just swallow for me. Perfect. Vagus nerve is intact. And then accessory muscle, last two. So for the accessory muscle, can you shrug your shoulders as I put pressure down? Perfect. Can you turn your head that way and then back this way? Perfect. Accessory muscles are working just fine, that's intact. And then for the vagus nerve, which is the 12th cranial nerve, or not the vagus nerve, the hypoglossal nerve for the 12th, can you stick your tongue out? Side to side? Perfect. And then can you say light, tight, dynamite?
Light, tight, dynamite.
Perfect. All right, so all 12 cranial nerves are intact. Now I'm going to do your deep tendon reflexes. Go ahead and sit on the edge of the bed here. I'm going to raise the gurney so that your feet are dangling. Perfect. So for the sake of this video, we're just going to be checking the patellar deep tendon reflex, but there is the brachial, biceps, triceps, radial, patellar, and Achilles deep tendon reflexes. We're going to make sure it's a 2+. So go ahead and just relax this knee for me. Perfect. It is a 2+. Deep tendon reflex was intact. So your memory, cranial nerves, deep tendon reflex was intact. The remote memory was intact. So now I'll go ahead and get you back into your bed. I'm gonna lift the side rail, lower the bed, put you in a position of comfort as well. It's not gonna work. That should be good. And then I'm gonna get your call light, make sure it's here with you, just in case. Side rail's up, you're in a position of comfort. Is there anything else that I can do for you before I leave?
That'll be all, thank you.
Perfect. If you need anything, feel free to use the call light, okay?
Thank you.
Thank you very much.